In the second section of our lecture, now we will talk about pre-eclampsia. We will talk about the incidence of pre-eclampsia, what are the risk factors that lead to pre-eclampsia and pathophysiology of pre-eclampsia. And then what are the effects of pre-eclampsia on different organs of the body. So first, pre-eclampsia. What is pre-eclampsia? Is hypertension or high blood pressure at least 140/90 millimeter mercury recorded on at least 2 separate occasions, at least 4 hours apart, in presence of 300 milligram protein in 24-hour collection of urine, arising de novo after 25. The landmark is after 20th week of pregnancy in patients who are previously normotensive, no high blood pressure, and resolving completely by 6th postpartum week. So pre-eclampsia is a condition, it's diagnosed when there is increase in blood pressure up to 140/90 on 2 occasions, should be at least 4 hours apart. There is increase in proteinuria. Now protein levels are increased, they are not normal, and there is increase of about 300 milligram in 24-hour urine collection of the protein. And usually this condition occurs after 20th week of pregnancy and resolves completely, gets better completely after 6 weeks postpartum. So very, very clear what's the condition: high blood pressure, high protein levels after 20 weeks of gestation, gets better after 6 weeks postpartum. Incidence of pre-eclampsia, this affects 5 to 8% of all pregnancies are affected by this condition. Leading cause of maternal and infant mortality, with nearly 76,000 maternal and 500,000 infant death each year. So very, very serious condition. About 76,000 maternal deaths and 500,000 infant deaths. So it should be regularly monitored, should have very, very regularly antenatal visits if there is any suspicion that this patient might develop pre-eclampsia. It should be treated on time to avoid the complications and to reduce the risk of any deaths. Occurs during pregnancy and postpartum, affects both the mother and the fetus and the baby. Very common in African American women, who are 4 times more likely to develop pre-eclampsia. From 1998 to 2006, African American women had 56% more preeclampsia than Caucasian women. So it's very common in African American women. Preeclampsia doubles a woman's risk for developing heart disease or having a stroke over their next 5 to 15 years. So women who develop preeclampsia during the pregnancy, they are at high risk of developing hypertension later on, and they have 5 to 15, after 5 to 15 years, they have chance of developing heart problems and stroke. So it's a serious condition, should not be taken lightly, and usually women who don't have regular antenatal visit, the outcome I already mentioned, very bad for both the mother and the baby. Risk factors for preeclampsia, there is, it's more common in first pregnancy, multiparous with previous history of Pre-eclampsia. So first pregnancy is more common, and then if there are more than one multiparity with previous history. Multiparous means having multiple pregnancies or deliveries. And if there is previous history of preeclampsia, there is chance that the next pregnancy will also have preeclampsia. Preeclampsia in any previous pregnancy, 10 years or more since last baby. So if there is a bigger gap between pregnancies, preeclampsia is common. Age 40 years or more, body mass index of 35 or more, family history, booking diastolic blood pressure of 80 millimeter or more, booking proteinuria of more than 1 plus on more than one occasion, multiple pregnancies, pre-existing hypertension, pre-existing renal disease, pre-existing diabetes, and anti-phospholipid antibodies. If there is any autoimmune immune disorders, usually anti-phospholipid antibodies are increased. So all these risk factors, they are very common risk factors that leads to preeclampsia, increased age, multiparous women, first pregnancy, previous history of preeclampsia, that's an indication that the next pregnancy can be preeclamptic. So good follow-up should be performed. And then we have multiple just pregnancy, chronic hypertension. All these are the risk factors for developing preeclampsia during the pregnancy. Pathophysiology that can lead to preeclampsia or high blood pressures. There is different autoantibodies for angiotensin converting enzyme, angiotensin inhibitor autoantibodies, if present, that can cause increase in the blood pressure. If there are new natural killer cells present, if there are any genetic factors, hypertension or high blood pressures, they run in the family. So if there is any history of preeclampsia or gestational hypertension in the sister or in the mother, usually it can lead to preeclampsia in the women. If there is any oxidative stresses present and some other factors, all they can affect the placentization. Placenta is affected, placentalization is affected, and once the placenta is affected, if there is decrease in the blood flow to the placenta, it can cause intrauterine growth restriction, and then it affects different organs also. It can affect the kidneys, it affects the liver, it affects the brain, cause edema, and it affects the blood vessels. So all these different factors that can cause vasoconstriction and decreased nutrition and decreased blood supply to the placenta can affect different organs of the body and can cause intrauterine growth restriction. Cardiovascular system, as I mentioned, mainly the effect on the blood vessels. In the normal pregnancy, there is vasodilation. So if there is normal pregnancy, usually there is dilation of the blood vessels, decreased peripheral resistance, increased plasma volume and cardiac rate. Usually in normal pregnancy, the blood pressure is lower than the normal because of vasodilation and decreased peripheral resistance. And in the preeclampsia, what happens, there is vasoconstriction, hypertension, high pressure in the blood vessels, loss of endothelial cell integrity. There is decreased or great vascular permeability and edema. So if you see the difference between normal pregnancy and pre-eclampsia, we have vasoconstriction that causes increased the permeability and cause increased flow of fluid, and it can cause edema. So these, if you see the diagrammatic differences, this is the blood flow, and there is dilation and good blood flow, but in here you can see there is vasoconstriction and narrowing of the blood vessels. So all these changes can lead to are as a pre-eclampsia, and then major differences are, one is vasoconstriction, one is vasodilatation, and then all the subsequent changes. Renal system is also affected by pre-eclampsia. Mainly the condition is known as glomeruloendotheliosis that occurs in pre-eclampsia. This is the anatomical diagram showing the kidney. Then we have impaired glomerular filtration occurs. This can lead to selective loss of intermediate weight proteins, albumin and transferrin. There is proteinuria, and there is reduction in plasma on cardiac pressure, and there is edema. So all these are the changes in the kidney that leads to proteinuria and edema in patients who have pre-eclampsia. There is decrease in glomerular filtration rate. As a result of decreased glomerular filtration rate, there is loss of protein, leading to proteinuria and edema. Then hematological system, in the blood there is endothelial damage. So there is damage to the endothelium, and this endothelium damage causes platelets adhere to damaged area, and there is diffuse vascular damage associated with laying down of fibrin. So whenever there is damage to the endothelium, there is accumulation of platelets, or there is attachment of the platelets, and platelets cause coagulation. So there is disseminated coagulation also in patients with pre-eclampsia. And there is increased fibrin deposition, there is reduction in count may accompany and predate onset of disease. So this is mainly what happens in hematological system. So cardiovascular main change is because of vasoconstriction, and that cause increased blood pressure, and that can cause decrease in the blood flow, and also edema. And then we have in the kidneys, there is decreased glomerular filtration rate, leading to increased loss of protein in the urine, and then proteinuria and edema. And in the hematological system, as a result of damage to the endothelium, as a result of pathophysiological changes, the platelets adhere to the endothelium, and they can cause intravascular coagulation. Then another HELP syndrome, how the liver is affected. HELP stands for hemolysis, elevated liver enzyme, low platelet syndrome. So this is HELPs is hemolysis, elevated liver enzymes and low platelet levels. So HELP syndrome, if we know, and then hemolysis, there is breakdown of red blood cells, production of bilirubin, can cause jaundice. Then we have low platelet counts also. Then we have liver enzymes are elevated. Epigastric pain is there, nausea and vomiting is present. Hypertension mild or even absent in HELP syndrome. Complications: acute renal failure, placental abruption, stillbirth can occur in the HELP syndrome. Stabilizing the mother, correcting coagulation defects or deficits, assessing of fetus for delivery. These are the all the steps for management of the HELP syndrome. Serious condition can lead to acute renal failure, placental abruption, and can cause stillbirth or death of the baby in the uterus. So pre-eclampsia is a serious condition associated with all the complications in the different organs of the body. Neurological systems, we have vasospasm and cerebral edema. Vasospasm and edema can occur in the brain, and there is retinal hemorrhages, exudates, and papal edema is present on ophthalmoscopic examination. When eyes are examined, there is swelling of the retina, papal edema, and exudates are present as a result of involvement of nervous system by the eclampsia. That was all about the involvement of different organs by the pre-eclampsia. Thank you for watching sqadia.com.